Okay, guys, this is the post-test certified emergency nursing exam. Had to go get gas and kind of just take a moment before I recorded the video. With saying that, obviously I did not pass. I got 105 out of, 105 out of the 106 needed to pass. So, unfortunately, it did not go well. So unfortunately, I'm going to have to wait another 90 days. With saying that, without breaching any non-disclosures that I agreed to at the beginning of the exam was definitely not what I expected. I mean, I solely used just a couple study guides. I can't even think of them right now because I'm still coming off that 3-hour exam. But long story short, spend longer than 3 or 4 days. I don't even know when I signed up for it. I think I signed up for it on Wednesday and decided to take it today, which is Saturday. Don't do that. Yeah, you can be critical care nurse, you can do emergency nursing, you can have an amazing career and do this for a long time. Done corpsman in the Navy. I've done a lot. I've seen a lot. I'm not questioning myself with the skills. It only has a 60% pass rate. But either way, just study properly because some of this stuff is really out there. And even with just the cramming that I did over the last 3 or 4 days, I mean, I might have spent a total of 3 hours total studying. So please do yourself a favor and study correctly. Long story short with that also is preparation. Prepare better. It is a difficult test. I got in there pretty confident that I would pass it with no issues whatsoever. And some of the questions were stuff that, like Mark Boswell, his name finally came to me. Mark Boswell didn't really even lecture about. A lot of it was pediatric based, which totally surprised me. I know there's 25 questions that are like for future CEN that aren't graded, but the amount of pediatric questions that I did receive on that, I mean, there was 1 or 2 times I double checked the top blue bar, which is part of the testing, to make sure I was taking the certified emergency nursing exam and not the pediatric one, because I can honestly say a large portion of this test was pediatric based, which totally surprised me. I mean, no calculations, no that, but you got to know your just your respiratory issues with your typical 2-year-old or 8-year-old. It's just, I can't go into details because of the non-disclosure. I don't want to jeopardize anything or get sued by WCEN or any of that. But long story short, I was totally shocked. One of my flaws, I think, on the test score report was the environmental and the toxoids, and some of them were way out there. Cyanide poison, sulfuric acids, triage also was a big part. And if I could pick one area that if I could redo studying again, I would have been the triage component and the environmental and toxoids, because I definitely could have pulled at least one more question or 2 more questions out of that. In saying that, yes, I'm pretty disappointed, pretty hard on myself, and never felt anything in my life. So this is a wake up, but also as my good motivational person I listen to is David Coggins, and it just is going to make me more hungry to pass in the next 90 days. Lots to be thankful. This beautiful sunset that is setting right now, giving me a good skin color. I mean, so overall, I mean, I'm bummed. The money aspect of it sucks. I mean, you lose the 230. At least the positive to that, the next time it's 200 if you're an ENA number, like an Emergency Nursing Association member like I am. So that's one thing, but I mean, still losing $230 is no fun for anyone. I could have definitely spent that money on probably 26 different other things that I would have rather done. With saying all that, not much really to say. Don't be like me and do the exam in 3 or 4 days. Not a good idea. Missing only one question. It's kind of like, yeah, like I said, I could have studied those 2 topics and pulled out one more question, but it's just like the what ifs, so many times. I'm really bummed that was one question away. And then the other thing is I got to wait 90 days before I can retake it. And that's frustrating too, because I just rather study another week and go ahead and take the test, but I probably should have done that to begin with. So long story short, even if there's no exam dates, and that's the whole reason why I crammed, the next available exam date for my testing centers is in 3 weeks, and I just wanted to get it done before I transition to flight nursing. Okay, I'm beginning to ramble, so this is enough. 5-minute videos are my goal. Make your day, make your night amazing. Be good to each other, and I'll keep you updated through this amazing flight nursing path. And like I stated, there's going to be some other videos coming out soon. Take it easy, y'all. I'm going to get home.